Hello, my name is Crystal. This is my very first YouTube video, and this video is titled My IVF Story, and it has to do with my experience seeking out and acquiring IVF because of my diagnosis of endometrial cancer and PCOS. So, a little about myself. My name is Crystal. I am 37. I use the word a lot because it is my favorite filler, and I know it can get a little distracting, but I will try to stop it. Maybe if I continue making videos, I won't feel as uncomfortable and it would be tons easier. So I'm married. I am occupationally, I'm a nurse. However, I am not an IVF nurse. I'm not a fertility nurse. So I'm way outside my comfort zone, and all of the information I'm giving you is purely my opinion. It is not medical advice. It is not, medical information that I'm trying to give you, or a medical, diagnosis I'm trying to give you. I'm just giving you my personal experience, and I decided to do this because I was trying to seek people on YouTube that had the same problem as me. And while everyone who suffers from infertility, it is definitely a struggle. It is a little easier when someone can relate to your scenario exactly. So I have endometrial cancer. What is endometrial cancer? Endometrial cancer simply means the lining inside of my uterus. There's cancer there. I have, that diagnosis, and I subsequently take hormonal therapy to try to get rid of the cancer that's there. In the meantime, I was instructed by my GYN oncologist to seek out some means to preserve my fertility, simply because this was the reason it took me so long to find a GYN oncologist, because everyone simply told me just to remove the uterus and be done with it. And that was not an option for me, since I had no children and I wanted to have children of my own. It's something I always wanted. I always saw myself as a mother. I'm already an aunt, and I love my nephew tons, and I think that's something that I want to accomplish in my life. So it wasn't as simple as someone saying just take it out, dash it on the floor, jump up 4 or 5 times on it and be done. No, I needed to hold on to my ability to have and carry a child. So my doctor told me I should find an IVF specialist, but being that COVID happened, it was very hard to find someone in New York, which is where I'm from, and I was forced to outsource. And my husband is a travel nurse as well, and he was traveling to Texas. So we decided to look in Texas, see if we found anyone in Texas, being that time really wasn't on our side. So we found someone that could see us as soon as humanly possible in Texas, and that's why I'm currently here in the hotel, extended stay. Before I get started, I'm not plugging this by any means. I'm just going to be referring to it, so that way you'll know where I got it from. So there's another YouTuber. Her name is Angel Grace, I believe it is. If that is not your name, I'm so sorry. But this is a gem, actually, because I was able to keep all of the information, or as much of the information as I go along, or as I progress, in this packet that she made, which you can download and then just print. And, so I'll be using that to kind of track where I'm going. So if I'm looking down or not looking at the camera, that's probably an experience, and I'm just trying to catch my bearings. I do tend to talk a lot. I tend to ramble on and on and on, and I'm going to try to keep the video short. I also have an accent. If for some reason you don't understand something I'm saying, I definitely have no problem responding to a comment or a question if you want to leave one underneath the video. So how I found out about my infertility was after I got that checkup and I found that spot, I had to have the biopsies done. And after I had biopsies done and they came back with a diagnosis of endometrial cancer, I then found a IVF doctor, like I said, in Texas, and he was able to see me right away. Actually, my appointment with him was December 4th. So on December 4th, I met with an IVF doctor here in Houston, and I had a consultation. At that consultation, he did blood work. He did a transvaginal sonogram or ultrasound, whichever you prefer. And it's the same thing. It's just a probe they insert into your vagina. It takes pictures of the uterus, it takes pictures of the ovaries, and helps him make a diagnosis, at which point he diagnosed me with polycystic ovarian syndrome, or PCOS. It's also hormonal imbalance, and it simply means, you get a lot of side effects, which I have quite a few of, but it also makes you produce a lot of eggs. Most of them are poor in quality. You just have a ton of them. So at that consultation, he also, gave instruction for me to start Provera. Now, Provera is a drug that would trick my body into starting to bleed. I've always had irregular periods, so I could have 2 periods a year, and altogether that time adds up to 5 months of me bleeding, or I could have 15 periods a year. It varies. So he just wanted to trick my body into bleeding, so he sent me home with 10 days of Provera. Once I finished my Provera, I had to wait until I started to bleed, and then I had to return to his office for the same blood work and for a sonogram, a transvaginal sonogram, which is a lot of what you're going to be doing if you decide to do IVF. Is they're going to be sticking a probe into, forgive my non-medical terminology, your it's going to be pretty frequent. It'll feel like almost every week you're there. At some points I've heard it's almost every day. And they do this transvaginal sonogram, and they do blood work. Now, definitely a little warning. That first time he does the blood work, at least for me, they took about 6 or 7 vials. It was quite a bit of blood, and it was a bit much. My husband also had to do blood work, and he had to take a container to deposit sperm for a semen analysis. After my Provera was done, I managed to make a follow-up appointment, which was for the 18th of December, and that was to get ultrasound and blood draw, but while I was bleeding. He wanted to see what my hormone levels were like, what my ovaries looked like, and everything while I was bleeding, while I was on my period. And then I was sent home from that appointment on the 18th with birth control. And the birth control he prescribed was something called Desogen. Now, that Desogen, I was supposed to take it for 10 days and then return to his office on the 28th. And that was supposed to be for my baseline. So, as with almost any other baseline, you just want something to compare things to. So he's checking, my hormone levels, because that birth control is pills that you're supposed to be taking for the 10 days. They're supposed to calm everything down, make your ovaries nice and quiet. So he wants to see what the ovaries look like nice and quiet. He wants to see what your hormone levels look nice and quiet, before he can put you on what they call stim drugs, which is just the opposite. It stimulates the ovaries, it stimulates the follicles, so that after you come off that birth control, or sometimes you continue on the birth control just simply to keep you from actually ovulating or releasing any of those eggs because you want to grow those eggs. So you may stay on it. I'm personally, my experience, I have to stay on it. So while I'm on it, he's also going to give me a stimulation drugs. So those I'm going to have to inject in my stomach, and it's no fun. So I haven't actually started those yet. I start those in about 4 days. That was the instruction given to me on the 28th. So currently, I am at that point. I'm waiting to see, on the 1st, once I start the stim drugs, I must return on the 4th. And from there, he'll do the same thing, an ultrasound, a blood draw. They want to see what my ovaries look like, what my hormone levels look like now that I'm on the stim drugs. And then from there, I might be going in every other day for the same thing, blood work and transvaginal ultrasound. So I was trying to keep my video really short, and this is actually my second take. The first take, it was like 30 minutes. I felt so bad. I was like, oh my God. So now that I've reached this point, what are my final thoughts? My final thoughts are IVF is hard. It is a lot of work. It's even harder when you're trying to balance another condition such as my endometrial cancer. I do take medications, hormonal medications to treat endometrial cancer, and I'm also taking medications for the IVF doctor as well. So it can be a little overwhelming. It can be frustrating. Also, I don't know if anyone has the same experience. My experience has been I don't like relay care. I don't like where you only see the doctor once. I've been to the office 3 times. I've only seen him 1 time, and that was for the consultation. Everything else, he gets the information, the lab work, the ultrasound, whatever, and then he relays the message through his nurse. His nurse contacts me. I like to be able to ask questions. I never liked having messages passed on to me because I feel like something always gets lost in the translation, and there's no way for you to immediately get an answer for a question. You have to ask somebody else who then has to ask them, then they have to communicate back the information to you. It can get super frustrating. Being that I'm a nurse, my husband is also a nurse. I try to understand that it is very hard for a nurse to manage all the patients. You're trying to give 100% of yourself to every single patient, and it gets overwhelming sometimes. You're a person, you have your own life, you have your own things going on, and it's a very difficult thing to do. So that being said, I would say, you do have to exercise a lot of patience, which is not really my strong suit. And you do have to keep a good sense of humor. You definitely do. So I think that also, if you are not like me, where you have a massive amount of time to find someone to do your IVF with, I would suggest interviewing other people, going to multiple consults, and finding somebody who truly gets your vision, somebody who can, you're able to contact them, you're able to reach out to them, talk to them directly without having, an intermediary. For me, time was a factor. I needed somebody I could see right away because of the cancer. If that is not an issue for you, then by all means, look for someone that really gets you. That's your right as a patient, as someone that's paying for a service. And IVF most times isn't covered, or there's a lot of it that comes out of your pocket, and it's a big investment. So that being said, I think that you have the right to really mesh with the person and be on the same page as the person that's helping you. So my doctor seems knowledgeable, seems like a pleasant enough person. However, I just don't like the idea of having relay information where it gets passed through 2-3 hands before you actually are able to get the information. So aside from that, I don't really have anything else to add. I was trying to aim for under 15 minutes, and right now I'm right at that mark. So if you have any questions, leave me a comment. Okay, I'll get back to you. Thank you.